Sol, and I'm Program Officer with the National Hispanic Medical Association. On behalf of the National Hispanic Medical Association, the Association of State and Territorial Health Officials, and the New York Health Department, we would like to thank you for joining us for today's webinar. Before we get started, there are a few housekeeping items to cover. As a reminder, to hear the audio for today's webinar, please call 1-866-740-1260 and enter passcode 318-54631 when prompted. In addition, to view the slides, please log on using a personalized web link sent to you upon registration. If you need assistance, please use the chat box located on the lower left-hand side of your screen. Today's webinar will be recorded and posted on ASTHO and NHMA's website. Notifications will be sent out when the archived content is available. We welcome your questions. Please submit any questions or comments you have via your chat window located on the lower left-hand side of the web screen at any time during the presentation. Questions will be addressed as time follows. Today's webinar will cover current trends in flu rate coverage, promising influenza practices, activities, and initiatives, as well as highlight resources for healthcare providers to improve influenza immunization uptakes among patients. We have 3 featured speakers today. Our first speaker is Dr. Delia Easton. Dr. Easton is currently a research scientist with the New York State Department of Health, Bureau of Immunization. She leads research and evaluation activities for New York State Vaccines for Children program. In her current role, she's interested in developing innovative and effective interventions to increase vaccine acceptance and uptake among under-vaccinated ethnic minority religious groups in New York State. Following Dr. Easton, we'll have Dr. Vivian Huang. Dr. Huang currently serves as Director of Adult Immunizations and Emergency Preparedness at the New York City Department of Health and Mental Hygiene and is the Medical Director of Health Department's Immunization Clinic. She is duly boarded in internal medicine and preventative medicine, with an interest in addressing and disseminating health inequalities that are pervasive within communities of color. And our final speaker will be Dr. Judith Flores. Dr. Flores is a Chief Ambulatory Care at the New York Health Hospitals in Woodhull and a Clinical Associate Professor at New York University School of Medicine. In addition to maintaining clinical practice, Dr. Flores has been active in the development and implementation of programs that address disparities of care for underserved communities in New York City. Dr. Flores is a member of the Executive Board of the National Hispanic Medical Association and is actively working as an advocate for more Hispanic physicians and actively working on issues of healthcare policy that impact the Latino community. Now it's my pleasure to introduce our first speaker today, Dr. Delia Easton.
Okay, thank you, Andrew, for introducing me. My name is, as you mentioned, Delia Easton, and the objectives of my portion of this webinar are to explain the rationale of efforts to promote flu vaccine coverage among New York State Hispanics and to show some overall flu vaccine coverage rates in New York State and examine various ways of estimating flu vaccine coverage among Hispanics and then discuss recommendations and resources for providers to use to increase flu vaccine coverage rates in this group. So first, let's talk briefly about the importance of initiatives to promote flu vaccine among New York State Hispanics, how Hispanics are affected by the flu, and factors that may be possible barriers to Hispanics accessing flu vaccine. So this map is the gradations are a little bit hard to see in it, but so we all, I think, realize that Manhattan, Bronx, Brooklyn, Queens, and Richmond counties have some of the most populous areas of Hispanic residents in all of the state counties, closely followed by the downstate counties which surround the city. But in fact, there are Hispanic communities located across New York State, and this map ranks counties in the state by percentages of Hispanic residents, illustrating where in the state Hispanics are located. The lighter gradations show counties with 4%, with darker shading showing greater percentages of counties with greater percentages of Hispanics. And this is all based on 2014 American Household Survey data. It's important to keep in mind that Hispanic ethnicity is often underreported or unreported, and usually doesn't include undocumented migrants. So these are all probably underestimates. And here's another view of Hispanic communities in New York State. based on the 2014 American Community Survey. And this is by census tract. And you can see that the census tracts with the highest proportion of Hispanics don't always correspond neatly to sort of the county division of those counties with the highest number of Hispanics. So it's important to keep both of these tools in mind for assessing figuring out where Hispanic communities are. If you're a Hispanic provider or you're serving Hispanics, you probably already know that, but this is a general piece of information. So why is flu vaccine coverage a concern for Hispanics in this state? Vital statistics data from 2010 to 2014 show that influenza in combination with pneumonia has been one of the top 5 causes of death for Hispanics in 2010, 2011, 2012, and 2014. And that's the most current data we have. Okay, so I'd like to talk a little bit about possible barriers to flu vaccine uptake among Hispanics. And it's important not to generalize too much because Hispanics in the U.S. and in New York State are a large, diverse group with different ethnic, racial, and cultural backgrounds. But in general, Hispanics tend to be poorer than Caucasians, and poverty is linked with lower flu vaccine rates. Hispanics may have lower incomes, fewer resources, and are more likely to live at the poverty level. Because of these reasons, and in addition to these reasons, some don't have access to optimal housing or nutrition options, all of which potentially influence overall health. Some Hispanics may not be able to readily access or utilize health care because of language, literacy, or cultural differences between themselves and the provider. Some are underinsured or uninsured, and because of these constraints, may only seek health care for critical or emergency issues rather than as part of preventive care, including getting vaccinated. In particular, Hispanic migrant laborers are unlikely to be insured and have limited health care options. And so all of this results in Hispanics tending to have poorer health care outcomes and having higher rates of chronic disease than Caucasians. For example, they're 50 times more likely to die from diabetes than Caucasians. Why is this important? Chronic disease does increase susceptibility to influenza. And finally, Hispanic individuals, like anyone else, may also be influenced by some of the misinformation about vaccine efficacy, and vaccine safety that are also influence individuals from other racial and ethnic backgrounds. And looking at Hispanics in New York State specifically, approximately 19% of New York State is Hispanic. Their median income, however, is the lowest of any racial or ethnic group in the state at $40,814. And almost a quarter of Hispanics in the state live below the poverty level, which is proportionally more than any other racial or ethnic group in the state. The diabetes mortality among Hispanics in New York State is 20 per 100,000 people. Moving on to talk about flu coverage in New York State. Just a brief check-in with where we're at with cumulative flu cases that have been confirmed in Wadsworth Lab here at New York State Department of Health. And this goes up through the 3rd week of the year. The weeks are listed by CDC week at the bottom. And as of yesterday, I think there are 4,350 flu cases of all types of flu confirmed. Looking at U.S. versus New York State flu vaccine coverage between 2009 and 2016, overall New York State does slightly better with flu vaccine coverage rates for children compared to U.S. children overall. And New York New York State children's flu vaccine coverage is approaching the Healthy People target of the Healthy People 2020 target. Our adult vaccine coverage rate is very similar to U.S. overall, but has been increasing. And let's look at coverage by age, also comparing U.S. as a whole with New York State. And this is for the 2015-2016 flu season. In each age group, New York State has slightly higher coverage rates, and this is particularly pronounced, you can see, among the 6-month to 4-year-old group. Now I'm going to talk about flu vaccine coverage among Hispanic New Yorkers, or possible ways of measuring that. So to start, the following are some of the tools that we have for looking at flu vaccine coverage rates. We have the Behavioral Risk Factor Surveillance System, which can look at coverage rates in the state and also by metropolitan and micropolitan statistical area. Every 2 years we have the expanded BRFSS, which gathers county-specific data, but there's often an issue with small sample sizes, particularly for the Hispanic respondents. So the flu coverage rates in the eBRFSS are sometimes less reliable. And we also can get information from the National Immunization Flu Survey for children and adolescents. Other options, last year and this year, for the first time there was a national internet flu survey that was conducted. This was a telephone survey. It was conducted only in English. And it was also available only to people who have either cell or landline phone service, and I think many people do. But again, this is not the best tool to probably try to assess flu coverage rates among more migrant populations in the state. Another tool that we have here is the New York State Immunization Information System, which is NISIS. And we have records for people in the state who are 19 years old and younger and county-specific rates. Unfortunately, the race ethnicity data that is part of NISIS is not reliably collected. So a question is it possible to use the metropolitan area or county measures is it possible to look at flu coverage rates by metropolitan area or county as a proxy measure to try to get a more nuanced understanding of Hispanic flu coverage rates on a local level? We'll talk about this in a minute. Okay, so this is one view of flu vaccine coverage rates among New Yorkers from 2010 to 2015, and it actually and this is a combination based on a combination of data sources, the National Immunization Survey, the BRFSS, and it looks very good from this vantage point. Here, this considers children and adults, and according to this, in 2015-2016, 49.6% of Hispanics received flu vaccines compared to 49.1% of Caucasians and 46.4% of blacks. So that's one view, and this is statewide. And here is a county breakdown of flu vaccine coverage. I know there's a lot of information here. It's really just to give a screenshot of how this looks. And this is for 2013 and 2014. These are the percentage of adults 65 years and older who had a flu shot or flu vaccine missed in the last year. So this is just an attempt, and this is not broken down by race or ethnicity. This is just a possible way of taking this as a tool and crosswalking it with either the county or census tract information on where Hispanics in the state live, and using these measures as a sort of proximate tool of understanding flu vaccine rates. But again, it's not ideal because this information is not broken down by race or ethnicity. another way of looking at flu rates is by metropolitan statistical area. And this, again, is percentage of adults 65 years and older who had a flu shot in the last year. And this is from 2015. And as you can, this is not broken down by race or ethnicity either. And it's very difficult to read these metropolitan statistical areas. Basically, Albany, Schenectady, Detroit, as you can see, they're very similar across the board, except for New York, Jersey City, and White Plains. But let's see. Albany, Schenectady, Detroit has a 64.3% flu coverage rate. Buffalo, Chickasaw, Niagara is a 64% coverage rate. Nassau and Suffolk County has a 62.7% coverage rate. New York, Jersey City, and White Plains is 58.5, and Rochester is 63.8. So again, looking at things this way, again, the coverage rates look fairly good, but again, we don't have a breakdown by race or ethnicity. So our last view shows race and ethnicity of New York State adults, and this is taken from, these are adults over the age of 18 who recall having a flu shot in the past 12 months. And this is broken down by race, ethnicity. And here we've got a very different picture. We've got only 14.7% of Hispanics recalling having had a flu shot in the past 12 months. And again, this is taken from BRFSS, but the confidence intervals here are very wide, so the data is not entirely reliable. The point here is that we don't always have accurate, consistent, or ideal measures of Hispanic flu coverage rates, particularly on the local level by county, metropolitan area, or census tract. Given this, my message is that it's important to consult various sources, to use multiple sources, and try to get a more complete picture of what's happening in terms of flu coverage rates for Hispanics. Now I'd like to briefly cover some recommendations and best practices for providers to use to increase Hispanic flu vaccine coverage rates. First, a very simple but important message that can be given to all patients, including Hispanics, is that it's not too late to get a flu vaccine. Although it's best to get the flu vaccine as early as possible every year, flu season usually peaks in February and can continue until May. So getting a flu shot late is better than not getting a flu shot at all. Secondly, here are some proven evidence-based strategies to increase flu vaccine coverage. You can find them in the Guide to Community Prevention Services. You're probably aware of many of them, but if not, I'll review them. At every visit, it's important for providers to assess patient flu vaccine status and recommend and offer vaccine on the spot if it's needed. Use of provider reminders is also very effective. Use of provider assessment and feedback is effective. Whenever possible, use of standing orders is effective. And New York State already has an immunization information system, and that's an evidence-based practice. And we only require flu vaccine records for individuals 19 and younger. So I think that's part of why we probably have better measures for flu vaccine coverage for younger people. Moving on to talk about some provider resources. Here's a screenshot of the New York State Department of Health flu vaccine resources for providers webpage. Here you can find clinical guidelines, surveillance data, recommendations from the Advisory Committee on Immunization, and recent notifications. So if you haven't checked out our webpage for providers, please do. And here are some other resources, just more easily accessed by links. The first is educational material that we have that can be ordered. The second is for health advisories for 2016 and 2017. And the final is the healthcare provider influenza immunization toolkit. And this is an example of our current, we have educational materials in several languages, including Spanish. Here's our most recent flu poster targeting pregnant mothers, and this is available in English and Spanish. And here's a flu fact sheet also available in Spanish. And finally, I'd like to leave you with links to a few additional resources. And that's it. And I believe we're taking questions at the end of this webinar. Thank you.
Thank you, Dr. Easton. We'd now like to introduce Dr. Vivian Wong.
So once again, thank you for inviting me to this presentation. My name is Vivian Huang. I'm the Director of Adult Immunization here at the New York City Department of Health. And today I'll be talking to you a little bit about influenza in New York City. I have no financial disclosures. And today's learning objectives will be to review the burden and impact of influenza in New York City. I will also describe the influenza vaccine coverage rates and trends in New York City. And I will discuss some of the current activities and initiatives to encourage flu vaccinations. And I will also share with you some of the current resources that we have for healthcare providers for the Hispanic community to use to improve flu immunization uptake. So let's look at the burden and impact of flu. So nationally, it is estimated that flu kills between 3,000 to 49,000 persons per year. And every year, an average of more than 200,000 hospitalizations are related to flu. So let's look at some laboratory-confirmed flu in New York City in 2015. In 2015, there were reported 10,776 cases. And just to keep in mind, lab reporting only represents a small number of patients tested, and it doesn't really give us a true incidence of flu in New York City. And here are some data on flu and pneumococcal disease in New York City. The last mortality data that we have is from 2014, and you can see that there were 2,220 deaths due to flu/pneumonia, and it is consistently the third leading cause of death in New York City. And of the top 10 leading causes of death, flu is the only infectious disease that's within that category. You can also see that we've had 630 cases of invasive strep pneumo disease, and 489 cases were in adults greater than 45 years of age. And you can see that it is the highest crude rate in adults is in 65 plus, where we have 21.6 cases per 100,000. So now I'll talk a little bit about our flu coverage rates here in New York City. And first, I'll just give you, just as reference, flu vaccine coverage rates from a national standpoint. And the flu vaccine coverage rates for adults 18 years and older is 42%. You can also see that the Healthy People 2020 goals is 70%. So flu vaccine coverage rate is well below that. Here you can also see other recommended adult vaccines, and they are also below the Healthy People 2020 goals. This here is data that shows adult flu vaccine coverage rates from 2009 to 2015. In the previous slides from New York State, they were using Berthas data, but for New York City, we have the Community Health Survey, which is a survey that's given every year to 10,000 participants. And I just wanted to show you that from 2009 to 2015, we have made some increases with flu vaccine coverage rates, but within the past couple years, those vaccine coverage rates have remained stagnant. And we are doing fairly, we're not doing as well with adults that are less than 65 with flu vaccine coverage rates. And with all of the coverage rates, we are below the Healthy People 2020 goal. This slide here shows the ethnic and racial breakdown for flu vaccine coverage in adults age 65 and older, and this is taken from the 2015 Community Health Survey. And you can see that overall the vaccine coverage rates is 65.5, but when you look across the race-ethnic breakdown, there is some disparity there, and you can see that with Black, non-Hispanic, that has the lowest rate. And so here are some of the reasons for low adult immunization rates. Adults a lot of times are not aware of the vaccines they need. They'll say that, you know, oh, I got all my vaccinations as a child, but many adults are not aware that there are also recommended vaccines for adults. The other thing is that healthcare providers that take care of adults are often very busy. They have other competing priorities, such as taking care of the acute medical issues. And many times adults have an incomplete vaccination history, so it can be confusing for the healthcare provider to determine which vaccines the patients need. The other thing that contributes to low adult immunization rates include that not all providers stock all the vaccines for adults. There is a cumbersome process for storage and handling, and also vaccines tend to be expensive, so providers may not carry the vaccines. And then very frequently, adults do see many providers, and this complicates the record keeping for the adult patient. And so these are all missed opportunities and resulting in low immunization rates for the adult group. So I've explained to you some of the reasons why we have low flu vaccine coverage rates. And so because of these low vaccine coverage rates, New York City, we do have many initiatives to try to encourage New Yorkers to get vaccinated against flu. And I'll just go over some of the things that we have done for this season. Here you can see that there is a picture of Dr. Mary Bassett, the Commissioner of Health, and we do a flu campaign kickoff with her. And this year our kickoff was on October 31st, and we chose to have the press event at a church in Bed-Stuy, Brooklyn. And we chose that because Brooklyn does historically have some low rates of getting flu vaccines. So this is to bring more awareness to flu itself and also getting vaccinated for flu. And as you can also see that we have a noticias picture here. The Hispanic newspapers did also cover the flu kickoff, and you can see that that's here in the picture. The other thing that we do alongside with the actual kickoff at an actual venue is that with our flu campaign every year, we do launch ads. And this you can see here is our flu campaign ad, and the slogan that we use for this year is "I got my flu shot, not the flu." And as you can see, we also have these ads that are also in Spanish, and we run these ads on the subway lines, in the subway shelter, in the bus shelters, and we also have done some of these ads on wrap ads in our commuter newspapers, which is AM New York, Diario, and also Metro. And we have some other initiatives to try to promote our ads and also to encourage New Yorkers to get vaccinated against flu. New York City DOH MH has a Facebook page, and we have promoted our ads there, and we've had ads on that page in November and December, and we will continue to do that for the following months. The other thing that New York City DOH MH has to encourage flu vaccine is that all New Yorkers can call the 311 line that we have here and can ask about anything that is related to flu and try to find a place to get a flu vaccine. We also have a text messaging service where if you type in 877-877, you can find a flu vaccine site. The user can type in also for Spanish, gripe, and then the zip code, and they will get 3 sites returned by text where they can actually get a flu vaccine. And now I'll talk about some of the resources that we have from New York City that are for providers, and here I'll show you We have something called the City Health Information Bulletin, which is a guide that's for healthcare providers. And every year we have an edition for influenza prevention and control, and this has been out since September of this past year. We no longer print these. However, if you're interested, you can click on the link here, and you can get to the most recent City Health Information Bulletin. On the other side here, you will see that we have an influenza health bulletin. This is a small pocket-sized bulletin that is used to help educate patients on what flu is and the complications and really getting a flu shot. If you want to get copies of these, you can actually call 311 and order them, or you can also download it from the website that's on this page. And I wanted to show you that we also have this health bulletin, and we print it in 4 languages. So we print it in English, and also here you can see we have it in Spanish. We also have it in Russian and traditional Chinese. We have it also in other languages where in New York where they are considered limited English proficiency, but we don't have them printed in bulk, but you can download it from the website. And just a few things I wanted to talk about that we do provide for the providers is that we do hold a quarterly meeting, which is the New York City Adult Immunization Coalition meeting, and our next upcoming meeting will be on Thursday, March 2nd. It's from 10 a.m. to 12. It will be here in Long Island City, so if there are any providers that are on the line or any vaccine stakeholders, we do encourage you to attend. And really this coalition is made up of stakeholders that are committed to vaccines and immunizations, such as medical facilities or healthcare, managed care organizations, federal, state, city government agencies, community-based organizations, colleges, universities, chain and independent pharmacies, and also vaccine manufacturers. And we are committed to the adult vaccine program really to eliminate barriers, identifying strategies to promote increased use of adult vaccines and to reduce vaccine-preventable diseases, mainly in adults. Just so you know, there's also a New York City Pediatric Immunization Coalition, and it usually coincides very closely with the adult one. So if you're interested in either one, please do get in touch. We'd be happy to have you. This time for the Adult Immunization Coalition meeting, we'll have some updates on ASIP for the 2017 upcoming year. We will have a case about a tetanus case that actually occurred in 2015. And then also we will have the Office of Labor Relations coming to talk about how we've given flu vaccines to our employees. So we do encourage you to attend if you are in the New York City area. And then lastly, I really wanted to talk about with adult vaccines, we have seen that pharmacists and pharmacies have been a real ally in trying to get our patients immunized. In fact, in the registry, about 50% of our immunizations that are reported for adults are coming from the pharmacy. So I wanted to just remind everybody that's on the webinar today that you can also send your patients to the pharmacy to get the flu vaccine, but not only flu, but also for pneumococcal, tetanus, meningococcal, and zoster. And if there are pharmacies that you know of that particularly service, the Hispanic community within New York City, could be a small mom and pop, we also do provide standing orders for those pharmacies where they cannot get a provider to write standing orders for these immunizations. So that's another resource for the providers out in the community if they wanted to send some pharmacies that they work with to our program. And here, lastly, are some resources. If you're interested in resources, we have some that are New York City DOH resources. There are some from the CDC. There's also the Immunization Action Coalition and many others. So I thank you for listening, and I think we are taking questions at the end of the webinar, and I'll turn it back over to the moderators.
Thank you very much, Dr. Wang. Okay, great. Finally, I would like to introduce you Dr. Judith Flores.
Well, hello. Good afternoon to everyone. I'm very happy to be on the same panel with Dr. Wang, and I've just met the other panelists this afternoon. We've learned a lot, and actually I'm also going to put a plug in for the coalition in New York City because we attended the last meeting, myself and a staff member, and we have made some very good connections, including Veronica Pryor from IPRO and some other people that are helping us in our initiative. So I just want to go forward and just let you know, of course, I have no financial investment in any of the immunization companies or pharmacies. And I'm here representing really providers that take care of populations that are underserved, many of whom are Hispanics. What we did in our initiative was really to turn it around and focus our work on people that are the older adult and the adult that is going to be complicated by chronic disease. We just got some information earlier in this presentation that the mortality rate among Hispanics is almost 50% greater in Hispanics. And that is something that's startling and something I really don't think really many of us as providers of healthcare understand how significant it is and how important it is to get these patients, particularly Hispanics, immunized that have chronic disease. So we focused a lot of our work in an area where we wanted to immunize the older adult with chronic disease using a model of the care team and care managers who are dedicated to making sure that patients stay out of the hospital and stay out of the ED and stay well. So what we did was we actually not just focused on the influenza vaccination, but we wanted to make sure that our patients understand that vaccination is for the older adult and that there are multiple vaccines that are necessary to keep them well, in particular influenza vaccine and vaccines for pneumonia prevention. Next slide, please. Hello? Yeah. So our baselines were actually not too bad in this particular practice. We did it says we did an analysis of 50 random selected patients. We actually have done much, much more. We've spread it from just looking at our older adult population to looking at our adult populations with chronic disease, including those that are 18 to 49, which are the most difficult to immunize. But looking at this particular population, we actually went from a baseline of 64% immunizations in the highest risk group to over 76, and we've maintained this. I have just April data here from 15, it says, but I have data way, way beyond January 15th. We've actually gone up significantly into the lower 70s and higher 70s and lower 80s for flu vaccination, and we've increased our rate significantly for the conjugate pneumococcal. Next slide, please. So what were our goals? Our goals, as I said before, was really to look at patients that had needed vaccination because of the severity of their illness, the incidence of their ED visits, and their readmission rates. We looked at healthcare expenditure, obviously, because we are in a large provider of choice for many Hispanics in New York City. We have that privilege. But we want to make sure that our patients are well vaccinated and that we are, yes, paying attention to chronic disease, but in particular paying attention to prevention with this population. So our goal was to improve the rates of both the conjugate and the other PCV13, Zostavax vaccine, and influenza above 85. It's rather ambitious, but we are going to maintain that goal and have so in the last year. Next slide, please. Oh, so what are our barriers? Our barriers are, we're looking at populations mostly, that are mostly Hispanics and older Hispanics. But when we look at even the population 18 through 65 and older, we find the same common theme. There's a perception that adults do not need them. They do not need vaccinations. They're very happy to bring in their children, and the pregnant women in our populations are very well immunized, but not the adult that does not have, that's not a child or is pregnant. Their preventive care is not a priority. The priorities are taking care of chronic diseases, usually when they are rather out of control. The other thing is we have to appreciate that we're in an environment where we have to address health literacy and that our tools are becoming more diminished. The dollars out there to make sure that we address LEP and health literacy and the knowledge base is diminished. And it does impact Hispanics more than anybody in this city. We've also missed opportunities, and we have a lack of strong recommendation by the care team. This is very, very important. If your provider doesn't make it a point that this is important for your care, you will not do it. Hispanics are generally very good at getting their children immunized, as I said. Most of that is under the recommendation of the pediatrician. That is a missed opportunity because many parents come in with their children, and we miss the fact that if we don't immunize the parent and the older adult, we're not completely protecting the child. So a lot of us have started for many years started implementing the practice that when the patient comes in with their children, we make sure we do everything possible to get the parent immunized. So that's a missed opportunity. So reasons for refusing, we already know that at least a quarter of people believe that the flu is not a serious enough illness. We need to share the fact that, yes, it is very serious. Yes, it's probably the third, I think it was already mentioned that it's the most common infectious disease for mortality, and it's also the third leading cause of death among Hispanics after heart disease and cancer, and definitely impacts the mortality severely among Hispanics that have diabetes. 11% chose not to vaccinate because they believe the vaccine is ineffective. So that's also issues of health literacy and education. We have cost issues and we have access issues. It says here due to the lack of time, it's also due to lack of access. If I cannot get immunized easily at my pharmacy, at my local store, in my school, in my church, it's very hard for me many times to make an appointment and come in and have this done. Next slide, please. So making adult immunization a standard practice. This is back to what we were talking about before. You have to have a tool easily to assess immunization status. We as adults do not walk around with immunization cards. This has to be implemented rather and streamlined, particularly for people who have limitations and barriers with language. We have to have informed and engaged patients, families, and caregivers. I don't know if we're as well informed as we can be on the need for this type of vaccination. And one of the things that influences this is that I noticed that many of our healthcare providers also don't appreciate the importance of being vaccinated. And that's something that we work on every day. To make vaccination part of a necessary care and optimize the administration, make sure that we can administer it cheaply and accessibly. If I come in with my child, don't make me come in for another appointment. Have somebody give me my vaccine at the same time and educate me on this. Okay, and we also always participate with our state. Next slide, please. Thank you. So what was our plan and our goal established? We did a lot of education with our staff. We did a lot of teamwork with our staff, and you can see the slide reflects this. But what was our results? Our results were really that the care managers, the nurses, and the providers started seeing this as a priority. So when patients came into our practices, we knew that they needed to have an assessment of their immunizations. They needed to get the message from the point of registration to the provider that this is a priority, and this will be very important for their general health, for the health of their family, and in many cases, for their survival if they have chronic disease, in particular diabetes. So we did a lot of, we also made sure that we could pay for the vaccine because we have mentioned that vaccination is costly, and in our system we want to make sure that we optimize our reimbursement and are able to take care of more patients in a better way, more effectively. So we made sure that we were billing appropriately, and that's key. Making sure you can continue to get immunizations for adults. Immunizations for adults are not generally free. We also a lot of patient engagement, a lot of patient education, and screening. About 85% of candidates were vaccinated for PCV13 and zoster by April. That was amazing to do. Now what we're trying to do is work on making sure we do the same thing for flu this season and making sure that we do the same thing and sustain it for next year. Next slide, please. Next slide, please. Okay, so interventions. We did this intervention in a geriatric practice because we figured our population there is about 70 to 80% Hispanic. These are monolingual, older adults that really have not been oriented to receiving vaccinations as an adult. Maybe they've done their children and their family members, but not them again. So we established basically, again, we went through our workflow and established this flow to address their need to be vaccinated as part of their routine care. And everyone has really gotten involved in this and taken to hold that these are their patients and want to make sure that their patients are immunized. So if I forget as a provider, that nurse is going to remind me that this is a priority for this patient. Next slide, please. All right, so what were our outcomes? This is a very interesting slide, and it's a very pretty slide because it shows a lot of bending the curve in the right direction. But what I like about it is that we did make a change and that we were able to sustain it. That our targets were exceeded is wonderful, but I think what it doesn't show is that we're able to influence patients to see this as a priority. Because in the beginning, we got many patients that didn't understand what was going on. We have the luxury of having many of our staff be bilingual, bicultural, so there was a lot of influencing and talking to the family, talking to the daughter of the 70-year-old, talking to the parent of the child, and getting people immunized by engaging them and educating them and addressing their health literacy at the moment of care, at the point of care. So we've been able to sustain this, and we're actually very proud of this and have been able to spread this to other practices in our department. Next slide, please. Okay, so what did we do? This is very preliminary. We're looking at what are we doing in terms of reducing ED visits and inpatient admissions. And we're going to test this more this year, but it looks like in many cases we did not identify cases of flu or pneumonia for readmission. But this is all very preliminary, and we will be looking at this year and see how it works out. Next slide. So what did we learn? We learned many things. We learned that awareness of vaccination policy implementation needs to be consistent among the clinical staff. So we have to educate ourselves, and we have to make sure that how we educate our patients is an acceptable way for them, that it's in their language and it is at their literacy and health literacy level. We did our documentation and made sure that we could pay for this, and we had policies in place that would support this work beyond the original care team. We adhere to screening of all patients, so we make sure that immunization is a priority throughout and that we address at least the 4 vaccinations that are important for these populations, at least in this practice. And as I said, we spread it to the other adult practices. So reasons, the last thing is, what are our next steps? So the next steps are, as written here, are really to continue to educate and to continue to spread this. But more importantly, we really have to spend some time in researching what particularly influences the Hispanic community. We have to find out why are Hispanics having such a high mortality rate with diabetes in conjunction with pneumonias and influenzas. How can we change that? We have to also look at the 18 to 49 population and see where we can leverage the work that we've done with children and apply that to the family. Hispanics are very family-driven. There's always some leader, be it the grandmother, the parent, the mother, that takes care of the health in the family, and that's the influencer. They also would like and usually can relate to people that are considered champions for healthcare. It can be the pharmacist. It can be the nurse. It can be the provider, but somebody has to be the person to give the message and be able to answer the questions and the concerns that people have about immunizing themselves, because they need to do that. So, and the last thing is immunizing on the spot. Someone mentioned that already. It is very important that where you are is where you can get immunized, and you have much easier access to these immunizations. So I want to thank you all for inviting me to this presentation. I hope I've been able to contribute something. And we are actually very excited in continuing this work here because it has influenced so much of our care and our health outcomes and improved not only care, but it allowed us to conserve our resources here by making sure that patients aren't sick, aren't admitted, and are able to come back to us well. Thank you very much.
Thank you, Dr. Flores, and thanks again to Dr. Easton and Dr. Wang for sharing your knowledge and information on useful resources for improving influenza immunization uptake. And we have some time now for a Q&A session.
Great, thank you, Andrew. So our first question is for our presenters, and the question is, what is the challenge to mandatory reporting for adult immunizations, and how can it be solved?
You know, the challenge really is, you know, we can't seem to get, you know, providers to actually have this general consent, you know, to get the patient to actually consent for it, and then to make sure that we can actually get it reported into CIR. So, I mean, the problem is that, so the successes with the pediatric community is that it's mandated by law that those doses have to be reported, but, you know, with the adults, you have this consent barrier. So I think, you know, how can we solve it? I think we need to talk, you know, we need to talk to the state and see if we can push some legislation to see if we can try to change that language. To make it so that it's not that, you know, you have to get consent, that maybe we can change it to language that says you may report. So if you wanted to report it, you could. And so there are champions out there like Dr. Flores, which I'm sure would be happy to report this information, not only to us, but to the state. So I think that's my perspective on it, and that's one of the huge, that's probably the biggest barrier for us, is getting that consent. So
Yes, absolutely. I agree.
Yeah, and so let me just talk briefly from the state's perspective. And it's true, yeah, the consent is a barrier. But in fact, there are providers who do have consent and get consent from some adults to record vaccines. So it happens sporadically. It happens in spots. I mean, I think everybody has a sense that this would be a good thing. It's just that on the whole, we're still struggling to get some providers to even report the mandatory doses that are given to children. So it's in terms of you know, overall effort, time, resources, and I guess will, in terms of, you know, providers, getting all of the providers on board with children. That would be the first priority, and then we could move on to adults from there.
Wonderful, thank you all. Our next question is for all presenters, and the question is, have any of these educational materials been tested with Hispanic audiences and in different primary languages?
Okay. I don't know if anybody else wants to take this. What we do here, we have I'm not going to say we're testing. We're smaller. We are practice-oriented, care team-oriented. We use a lot of the material. However, we often find that we have to make it much more visual, and giving materials out, leaflets out, unless you know this, unless you complement it with someone that's either speaking the patient's language or understands the patient's concerns, it's limited in effectiveness. So we do a lot of work with distributing materials, but it has to be complemented with, and it has to come from the right person. You can't just give me a pamphlet that is multilingual. You really have to support what's in the pamphlet, meaning you, the caregiver.
And at the state, we're recognizing that as well, and working on developing some materials that would be more user-friendly, particularly for Spanish-speaking, lower literacy patients. So we're working on that. It's happening. It's not happening as quickly as we'd like.
I find that in many cases there are lots of things that are, you know, paper-based, because that's what traditionally we use, and we use written language. And the most effective things I've seen are videos, YouTubes. I mean, anything that I can find very visual is probably more helpful.
So just to piggyback on both what Delia and Dr. Flores was saying, is that we are actually having an upcoming, so we are actually producing an adult immunization toolkit. So it's not just flu related, but for all the adult immunizations.
Great.
And we will actually be doing a focus group coming up in February, and we will be doing it with Spanish-speaking patients. So we will be able to find out more information on some of the materials that we're using and how well they're tested. And so we can report back to you when we have updates on that. So stay tuned, and we could give you some more information on that. But from what we did also do some focus groups in the past, and I do recall that from the Hispanic-speaking groups, I believe that they do trust the CDC and the New York City Department of Health resources. Those are trusted resources. They do trust that. And I believe that they also do trust their providers, giving their recommendation. I'd have to look back and see what the focus group said about, because we did actually get some Spanish speaking for a previous focus group, and I can also share that information. So for, I believe it was Alfonso that asked the question, we can definitely pass that information along to ASTHO and then can disseminate out to the group.
Yes, that's very good. Thank you so much.
Yeah, you're welcome. Yeah.
Wonderful. We have a lot of questions, and we're running short on time. So what we get to for questions, the rest will be answered after the webinar, and we'll be sending those answers out. But for our final question, we have a question, and it is, can these practices be translated to smaller practices with little resources and time? And if so, how can we make this a priority?
I don't know who the question is for, but I would say, and this is Dr. Flores, I would say yes, because a lot of these practices that we share here, we start off in the smaller practice and then spread to the larger practices. But yeah, I would say the most important thing is I think someone mentioned the will. Yes, we all have to have the will and make it a priority that this is very important, that we need to immunize the adult. We are the caregivers, we are the physicians, nurse practitioners, nurses, front-end staff. Everyone has to be pretty much giving the message. You can do it as long as the problem sometimes with smaller practices is economics. The immunizations can be expensive, and you may have to find a place that you can easily get your patients to receive their immunizations for free, particularly zoster. That's one that the practices don't like to carry because they need to be frozen, and they can lose a lot of money if the refrigerator goes off at night. Yeah. But I would say yes, it can. The most important thing is to make sure that you have engaged your priority with the providers that this is important in as part of the care and keep people well out of the hospital, especially with Hispanics who have this is a leading flu, and pneumonia can be a leading cause of death. This is Vivian here at New York City Department of Health, and to address Diana's question about smaller practices, I wanted to actually just talk about a program that's going to be upcoming. We will be doing a nurse detailing program where we are trying to recruit practices to really help them increase their adult immunization, so not just for flu. I know this program was mainly around influenza, but if you are interested in having a small practice recruited for this project, we will be teaching them about the standards, maybe trying to implement standing orders if it's feasible for the small practice. We will also be teaching them about the adult immunization toolkit that we have. So we're happy to, we will be recruiting very soon, and so we can also get that information out to ASTHO and to NHMA. Thank you so much again. This is a great thing. Yeah, definitely. Yeah. Very good.
Yeah, thank you all.
Thank you for chatting your questions. That's all the time we have for answering your inquiries today. As mentioned earlier, a recording of today's webinar will be available on ASTHO's and NHMA's website shortly. Finally, we'd appreciate if you took a few moments to complete a quick webinar evaluation. The link to the evaluation is on the screen and will be sent via email after the webinar. We greatly appreciate your feedback. It will guide us for future webinars. Thank you for participating in today's webinar. Have a wonderful weekend.
Bye-bye.